Welcome to LUTV News InFocus, where we feature interesting topics on campus, in the community, and in the world of culture. I am Briana Dupas. The on-campus clinic had an incredible start to the year. The Lamar University Student Health Center became an accredited clinic from the Accreditation Association for Ambulatory Health. Shawn, the director of the Student Health Center, is here to talk about the process of getting accredited and what this means for the clinic. How are you doing this afternoon?
Doing very well, thank you.
Okay, so can you give a little background about the Accreditation Association?
The Accreditation Association is a nationwide organization made up of healthcare professionals that set standards that university or public clinics are able to participate in and become accredited. And accredited would be meeting certain standards of patient safety, of internal assessment, looking at quality assurance measures. It's quite a long process, but it's a high honor to make sure that you achieve all of these standards that have been set forth by our healthcare peers.
Okay. So specifically for the process, as you stated, were there any steps that you had to take that got the Student Health Center to be accredited?
Yes. They actually sent us a book, and there are, I think there are 22 chapters. Those chapters, each individual chapter is a value or an area that is looked at internally by the organization, and then external peer reviewers do an on-site visit and look at our processes. So the first 8 chapters are core values. So we look at things like patient rights and responsibilities. They look at our governing body. We had to do a complete review and revamp of all of our policies and procedures. They wanted to look at any studies we were doing on infection control and quality assessment. So the process took us about 18 months from start to finish, and everyone in the health center had a specific role and assignments to finish so that we cohesively could come back and present our clinic up for review.
Okay. Was this the first time you, the Student Health Center, have tried to get accredited from this association?
Yes. Because it looks like such a daunting process, I had held off a little bit. I needed to make sure that the medical clinic, my counselors, and the health education department, which is all under the health center, that those assistant directors were on board, because I couldn't do it by myself. And it takes so long and is so involved. We had to make sure our timing was correct. We had to make sure that we had time to prepare and then invite the on-site surveyors at a specific time when we were able to, had a little downtime, and it wouldn't interfere with actually seeing students during the survey.
Okay. I've heard from some students after seeing the news about the accreditation, they were sort of concerned about what does this mean in terms of now that the Student Health Center is accredited? What does that mean? What did that mean beforehand, and what does it mean now? They believe that it's sort of, it's not very, since the accreditation is there, it makes you more credible. They believe that before you had that, it wasn't much of credibility.
Not necessarily. One of the things that myself and specifically the assistant medical director at the clinic, we attended one of our national conferences, and one of the sessions was to present and encourage university health centers to go through the accreditation process. So while we sat through this particular session, we realized we are doing and we have already met all of these steps. We just haven't documented it. We don't have it down on paper, if you will.
Okay.
There were a few things that we needed to look at, some of the formal studies, but we have always tracked flu vaccine trends, and we have always communicated with community resources and the Beaumont Health Department about trends in diseases that we are seeing and being diagnosed in the clinic as well as in the community, and are we doing everything we need to do for the students, just like a regular medical clinic or psychological clinic in the community. And we were already doing that. We just didn't have it down, and it wasn't a formal notification.
Okay. Mrs. Gray, it was a pleasure talking to you.
Thank you. Thank you.
Thank you for watching LUTV News in Focus. To see more content from LUTV News, follow us on Twitter and like us on Facebook.